I'm sure, like me, you want to achieve peak mental health. Today, I'm going to share 3 widespread cultural myths about mental health that may be keeping you from living your best life. Not only are these myths incorrect, but they can lead you to waste your time. And the last one can even turn you into a less effective person. So be sure to stay tuned to the end. These aren't the typical mental health myths you might have heard, such as there's no shame in having mental illness. That's absolutely true, but that's not what I'm going to be talking about today. I intend this to be a little bit provocative, so if you disagree, I'd love to discuss it. Please share in the comments. I'm Anne, and I'm investigating philosophy, psychology, and more so I can figure out how I can live my best midlife. I'm sharing as I go. I'm a former data scientist, and I have a PhD in research methods and statistics. So I'm pretty good at absorbing and distilling the latest scientific and philosophical thinking about living a good, happy, and meaningful life. The first cultural myth that we're all steeped in is the Freudian idea that our childhood needs to be fixed before we can have peak mental health in adulthood. Sigmund Freud was an Austrian medical doctor who decided to work on mental health. Freud came up with the idea that things that happened in our childhood left us with unconscious coping mechanisms that affect our adult mental health. While many therapists still practice psychoanalysis as Freud defined it, more modern techniques such as cognitive behavioral therapy, acceptance and commitment therapy, and dialectical behavior therapy are probably more effective in getting you to peak mental health now. You're probably better served by focusing on how you're acting and behaving and thinking right now if you want to improve your mental health. You don't need to go back and think about your childhood or fix anything that happened. The second cultural myth we have about mental health is this idea that some problem with our neurotransmitters is the cause of things like depression and anxiety. We think this because popular antidepressants like Prozac do act on neurotransmitters and change their levels. Although these medications immediately change levels of neurotransmitters, most people don't find any effect of the drugs for a few weeks. Meta-analyses, which combine multiple studies of antidepressants into one overall assessment of evidence, suggest that antidepressants may not be any better than placebo in addressing symptoms of depression. So you may be better off in using talk therapy or self-help books or other techniques in improving your mental health rather than taking a pharmaceutical route. The third and most harmful mental health myth we have as a culture is the idea that there is something real about a diagnosis of a mental health disorder. It turns out that the DSM, the manual that psychiatrists and clinical psychologists use in diagnosing mental disorders, has many problems. It's been changing over the years because it doesn't represent a reality about human disorders. Using the DSM, different clinicians may come up with different diagnoses for the same set of symptoms. This is because there isn't any reality to the particular disorders. If we were to find a physiological basis for a mental illness, it would cease to appear in the DSM, and it would become something for non-psychiatric doctors to attend to. Another problem with the DSM is that diagnostic categories are generally getting larger over time. So ordinary human behavior is being turned into a disorder or a pathology when previously we didn't think it was. This means you could get a diagnosis when really what you have are normal human problems. Many people find it very helpful to have a diagnosis of a mental health disorder. This is because these can point to ways of treating and ameliorating the problems that you suffer from. This is a very useful way of using mental health diagnoses, but you can take it too far. Some people use their mental health diagnoses to say that they don't have control over how they feel or how they act. It reduces their sense of agency and responsibility. This is problematic because if you have a sense of responsibility and agency, you're generally going to be a more effective person in the world and happier as well. To the extent that mental health diagnoses reduce our sense of agency and responsibility and free will, they make us into less effective and less happy people. So now that we've covered these 3 myths, we can talk about 3 tips. The first tip is don't worry too much about what happened in your childhood. Of course, if you're suffering from post-traumatic stress disorder due to severe abuse or other very serious difficulties in your childhood, you may need to focus on that. But for most of us who had pretty okay childhoods, the thing we need to focus on is our adulthood, our thoughts, our actions, and how we take responsibility for ourselves. The second tip is don't feel you need to take an antidepressant just because they're so popular and you've heard that they're very effective. The most recent research suggests they may not be any more effective than placebo. So instead, look to modern talk therapy techniques, which you can learn either with a therapist or on your own through reading books and practicing the skills that they teach. The third tip is don't let a mental health diagnosis take away your sense of agency and responsibility. The one main thing you can do to have peak mental health is to take responsibility for yourself. If a mental health diagnosis is pragmatically valuable to you and it helps you find ways of becoming a more effective person in the world, go for it. Just don't let it take away your sense of agency, autonomy, and responsibility. I'll be sharing more videos about how you can take responsibility for your mental health and improve it, including things like how you can stop catastrophizing, which causes anxiety, and how you can deal with an inner critic. I'm Anne, and I'm studying psychology and philosophy to live my best life, and I want to share what I find with you. If you're interested in hearing tips as I share them, please subscribe, and you can ring the bell if you want to be notified as new videos are published. I'd love to hear your thoughts on this. What do you think about the myths I shared? Do you agree that they're myths? How do you find peak mental health? Please leave a comment if you'd like, and thank you so much for watching.